So I'm Arielle Medford. I'm a medical oncologist that specializes in breast cancer. I work at the Massachusetts General Hospital and Harvard Medical School. Breast cancer, we are so fortunate, has had so many advances in recent memory. So we are now able to have even more refined treatment regimens for patients in the curative intent setting, as well as in the advanced breast cancer setting. So targeted therapies, more refined diagnostics, where we are able to hone whether or not patients need chemotherapy, for example. If so, what type of other targeted therapies, and the ultimate goal is to cure more patients and reduce toxicity. Yeah, so I have a particular focus on liquid biopsy. Historically, that's been used in the advanced breast cancer setting, and then fortunately, we now actually have the capability of measuring levels of DNA from tumor cells in the early breast cancer setting, which is where I have a particular focus and what I'll be speaking about today. So it's called molecular residual disease, or MRD. It's a really novel concept and relatively new in solid tumors. What it means is after a patient has had curative intent therapy, we're actually now able to use assays that are so sensitive that we can monitor patients for evidence of recurrence, ideally months prior to them actually having a recurrence. And an area that I'm very interested in is using that as a tool to, one, understand why patients are developing resistance so that we can better tailor therapies immediately after surgery, and then two, have better therapies to actually intervene with the ultimate goal of curing more patients. There are a number of assays that are available now, and so in the United States patient population, they're depending on the insurance coverage, but we know that there is coverage for one assay. The Signatera assay is reimbursable for stage 2B and above breast cancer, as well as in the neoadjuvant, so the pre-surgery setting, which is another novel use of these really sensitive assays. There are a number of different assays in the pipeline as well, and reimbursement, I believe, is still yet to be determined on what that would look like. And similarly, reimbursement mechanisms for earlier stage breast cancer, I believe, is still pending.